For this week's lecture, we will be going over athlete needs analysis, which is an important component when developing programs for athletes. So, the early 1980s, research in the exercise science field had demonstrated that changes in specific variables relating to exercise influence the type of adaptations and improve performance. Acute program variables were then a concept to better describe all the components of a workout. The acute program variables are choice of exercise, the order of exercise, the resistance or load used, the number of sets performed, and the amount of rest between sets and exercise. To have an effective training program, this needs to be tailored to demands placed on athletes by their specific sport, such as either hockey, football, soccer, whatever specific sport your athlete or even yourself are playing. Thus, to help better tailor the needs for the athletes, a needs analysis was introduced. This allows the strength coach to make informed choices for each of the acute program variables to design an appropriate program for different sports and individual athletes in itself. This includes certain position types as well. So you're not going to have the same exact workout for a football lineman compared to a running back. In addition, this allows to develop training-specific goals tailored to that athlete. So if an athlete has a specific goal on working more on speed, agility, hypertrophy, power, whatever the case may be, this is going to allow you to tailor that program to their needs. Part of the needs analysis is assessing the athlete. The training status of the athlete will play an important role, but some other things to consider is what type of training have they done previously. Have they mainly been focusing on hypertrophy training, strength training? Have they even done or even performed power training at all? This will all depend on their training status and even their training history. Another thing to consider is their recent training program and their intensity that they used previously. So with the intensity, this is based off of percentage of 1RM. So did they mainly focus on 60 to 85% for their hypertrophy range, or did they mix it up on having higher intensities focusing on strength and power, or lowering it and focusing on endurance? Lastly, how well is their technique can play an important role and is vital to this needs analysis assessment. You'll see a lot of individuals have poor technique within the gym or on a specific exercise, and just by fixing that you can see dramatic increases in performance. So we'll go a little bit more in detail on the actual training status of athletes and how it can affect testing in next week's lecture. Importantly, a needs analysis answers three things. One, what are the metabolic demands of the sport as this relates to the energy systems that the body will utilize during competition? Two, what are the biomechanical demands of the sport, such as body and limb movement patterns and what muscles are involved? And three, what are the common injuries observed in the sport profile? Are the injuries more common in upper body or lower body? And if so, there are specific areas for the injury. And we'll kind of talk about this later in this chapter. The combination of a needs analysis, the initial testing data, the evaluations of athletes helps pretty much strength conditioning professionals examine the athlete's general fitness base, their sport-specific fitness, their injury history, and physiological and biomechanical demands, and the evaluation of potential risk for injury. Pretty much the ultimate goal when you're a strength and conditioning professional is to develop a total conditioning program to improve performance and help reduce injury. All sports have a predominant metabolic pathway which depends on the sport, the position the athlete is playing, and the muscles being used. We tend to categorize energy utilized through certain time ranges from the metabolic system. This ranges from an immediate very short duration to long duration. So for example, the table gives a general overview of the predominant energy system used for a certain sport. You can estimate what the predominant metabolism will be for the primary muscles that are being utilized. So for example, baseball players predominantly use the ATP-PCR system. Thus, the training for the aerobic system should not be of primary concern. However, it's still going to be important to incorporate aerobic conditioning as there's still some sort of involvement with that. But sport-specific conditioning should aim to train the same metabolic system used in the sport itself. However, sports can also have a combination of the metabolic systems, and we can see this through kind of speed, endurance sports itself, such as hockey players, basketball players, rugby players, where this shift can be from anaerobic and then to aerobic during recovery. To give a quick overview, ATP is the body's energy molecule and produced by anaerobic and aerobic energy systems. ATP is crucial in the sliding filament mechanism or theory. The primary concerns in sports include the amount of ATP energy required during competition, how rapidly it must be available, and whether the metabolic conditions present can be tolerated. So conditioning programs should place a major emphasis on improving capabilities to produce energy and tolerating the associated metabolic demands to that sport. Although sports are either described as anaerobic or aerobic, no sport will tax a single energetic system alone. The level of oxygen required within the system goes from low to high in order to sustain activity. So for example, the amount of oxygen required to perform a 1RM is a lot lower compared to the amount of oxygen required for running a marathon. The three energy systems utilized by the body for training in sport is the ATP phosphocreatine system, glycolysis system, and the oxidative system. The ATP PCR system is the fastest rate of ATP production and is generally utilized in short duration, high intensity exercise such as sprinting or resistance training. Glycolysis is from the breakdown of glucose in the sarcoplasm of the muscle fibers. Glucose can be from blood glucose or intramuscular stores of glycogen. An example where the glycolysis system is being used is during a 400-meter sprint. Lastly, the oxidative system is the longest in duration at which ATP can be produced and includes the electron transport chain. An example where this will be mainly utilized is in pretty much ultra-endurance athletes and marathon runners. The ATP PCR system starts to fatigue around 6 seconds. Once exercise duration exceeds that time limit, other systems will begin to take over. Overall, the athletes must be able to meet the demands and preferably exceed these metabolic demands for their certain sport to achieve optimal performance. Again, the design of the conditioning program that you will be pretty much conducting or developing should be specific to the demand of the sport and the actual position. Next is the biomechanical assessment. This is based on the types of generalized body and limb movements that occur during the event, such as position of the body in space, the timing and coordination of various parts of the body, the speed of the athlete's body or parts during the movement, and the length of time of exertion for an athlete. By examining the primary muscle actions used in the planes of motion in which they take place, such as the sagittal, frontal, and transverse planes, can help the strength and conditioning professionals examine the joints involved during competition. So for example, or just to kind of refresh, the sagittal plane kind of splits the body into left and right halves. The frontal plane splits the body in front and back. And lastly, the transverse plane splits the body in upper and lower. Nevertheless, the biomechanical analysis can help strength and conditioning professionals by analyzing the type of movement, the range of motion of joints during competition, the required speed of movement for the sport itself, and pattern of muscle action during movement. This can help choose exercises for the resistance training program by having athletes perform resistance exercise that are biomechanically similar to that of their sport. General pattern movement will be either static or dynamic within a specific plane or planes of the movement. Dynamic movement can be categorized such as either open or closed. So open dynamic movement is where the hand or the foot will be free to move and the body will remain relatively static. And we can see this in the example where an individual is kicking a field goal, where the body is relatively stable or static and the hands and the feet are freely movable. When we relate this to resistance training, an open chain movement is the knee extension exercise. And you can see this in the picture to the right where the feet are not in contact or pretty much not in contact with the ground and are freely movable in itself. A closed chain movement is where the hand or the foot is relatively static and the body moves relatively freely. An example when we talk about resistance training is deadlift, and this is a closed chain movement. As you can see that the feet are in contact with the ground and not moving, but the whole body will be moving on the concentric movement itself. When looking at the movements for muscle, there are three primary types of actions: isometric, concentric, and eccentric. So isometric is where muscle develops tension but does not shorten or lengthen, and for this example, think of wall squats that you may perform. The quadriceps and the hamstrings are contracting but are not shortening or lengthening. Isotonic is where the muscle changes length while the load on the muscle remains constant. So isotonic consists of the concentric, where the muscle shortens, and the eccentric portion where the length of the muscle increases. In this example, think of bicep curl that you can see on the picture to the right, Whenever you are curling the dumbbell or the barbell, that's where the concentric portion is coming into play and the muscle is shortening. And whenever you're lowering it back down, that's where the eccentric or the muscle is lengthening. Another consideration for sport movements is the speed of the movement or angular velocity of the involved joint. Speed of the movement is generally given in reference to limb movement or rotational speed of the body around a central axis. Determining speed of the movement requires special equipment that is found in a laboratory setting. So we can determine the speed of the movement or velocity at the knee joint using the biodex equipment that is in the exercise physiology lab. So how we determine the speed of the movement or velocity is having an individual perform a knee extension. When we relate this to lifting, we can determine the velocity by using a tendo unit that can connect to the barbell during squats or even during deadlifts. However, certain strength and conditioning professionals may not have access to this equipment and should use their best judgment to kind of estimate the speed of the movement. It is important to observe joints that are vital to movements within the action. Primarily in most sports, that is observing speed of the movement at the hip, knee, ankle, shoulder, elbow, wrist, or even the hand. Further, positioning of the trunk and the movement of the torso throughout all athletic movements should be considered. Speed of muscle force development should be considered as well. This relates to performing athletic movement and stabilizing the torso and body throughout an action, such as keeping the torso upright during a spiking motion in volleyball. Strength coaches can determine and distinguish when the muscle action is causing a movement to occur, stabilizing the body, or controlling the loading of a limb from an external force. It can be generally understood that acceleration is through concentric muscle action, deceleration is through eccentric muscle action, and stabilizing is through an isometric type of action. Strength and conditioning professionals should follow 4 important questions when putting analysis into practice. 1. What are the patterns of movement such as concentric, eccentric, or isometric, and which planes of movement are involved? Secondly, what joints are involved? Thirdly, what muscles are recruited and what are the actions? And fourth, what is the duration of time that the athlete is engaged? The goal of analysis is to manipulate and match the acute variables that govern the program design to match the metabolism and movements involved in the specific sport. The use of biomechanical analysis of an athlete is used with advanced video equipment or watching a video that is recorded during practices or games. The things that can be helpful when analyzing the video is selecting a specific movement in the sport, such as a jump shot in basketball. By looking at the entire sequence of the movement multiple times, this will allow you to find out which part needs work on. Is it the follow through, or is the elbow position at a certain angle not allowing the ball to travel in the optimal path? Other things to consider depending on the sport is determining where the most effort occurs within the range of motion. Facial grimaces or tense muscle can help identify points of peak intensity during this range of motion. Another useful thing is to estimate the velocity of movement in different phases of the range of motion. A way to do this is that you can time between frames from a recorded video from practices or even games. In general, a coach can critique your form based off experience throughout their career without video analysis. However, video analysis can help pinpoint the specific issue. Biomechanical analysis can ensure proper exercise selections when programming. However, there are some exercises that are universal in which all athletes can benefit from. These include the squat, hang cleans, and shoulder press. Additionally, multi-joint exercise is important as single joint exercise cannot improve neurological coordination between joints. On this slide, we can see the terminology when relating to biomechanical movement, which can help strength and conditioning professionals select exercises for program design. The terminology listed here should be well known. So for example, one of the types of movements is abduction or abduction, which is movement of the arm or leg away from the midline of the body. An example of this type of exercise is shoulder lateral raises. Adduction is movement of the arm or leg toward the midline of the body. An example for resistance exercise is performing cable flies. A needs analysis will allow you to design a program that diminishes the risk of injury to the athlete. An injury is generally any trauma to the body. Majority of injuries in sports affect the musculoskeletal system such as bones, ligaments, muscles, and tendons. In other cases, injuries may affect the neurological system such as getting a concussion and the cardiopulmonary system such as having a heart attack. Even through a needs analysis and proper programming such as exercise selection and some form of periodization, sometimes injuries are just unavoidable. When looking at musculoskeletal injuries, this can occur through mechanical overload or repetitive overuse of a joint, limb, or muscle group. Mechanical overload can be related as contact, such as tackling the opponent in football, or non-contact, where injury can occur without direct contact from another athlete or object. Contact injuries come from a limb or joint being exposed to an excessive load that is caused by an external force, and from this excessive load, the tissue around the limb or joint fails to meet the demand and thus becomes injured. So when enough force is applied, this can cause fractures of bones or ligament ruptures. Non-contact injuries occur from either speeding up or slowing down and change of direction movement. You will see non-contact injuries occur in the knee, such as ACL injuries. This can be seen in soccer players or running backs in football who change directions when planting their leg while moving at a full speed. It seems that injuries coincide with two factors. The first factor is that the risk of injury increases when an athlete becomes fatigued or, in general, central fatigue. The second factor is that the risk of injury increases when the athlete experiences tissue fatigue, where the joint, bone, ligament, tendon, or muscle cannot respond to the forces placed on it. The result of injuries can be thought of as a fatigue-induced cascade of events, which starts with either central fatigue or tissue fatigue. Programming of resistance training and anaerobic conditioning and through nutrition can help the athlete attenuate fatigue and prevent potential injury. Not only that, a proper exercise program design can help address injuries that occur during competition. But, depending on the injury and location itself, different exercises will be utilized to help reduce the risk. For example, if we think of ACL injuries, selecting exercises to strengthen the muscles around the knee will help reduce the risk of another ACL injury. Let's take a look at the cascade of events that can increase the risk of injury. We can see once an athlete becomes fatigued or fatigue is induced, there's a breakdown of kinematics and thus leads to improper loading or uncontrollable movement for certain limbs, and then this leads to injury. Strength and conditioning professionals who have a good understanding on the metabolic demands of a sport may help offset one of the steps towards injuries through program design. For example, short rest circuits may help athletes who primarily use the ATP, PCR, and glycolytic system improve buffering capacities to help offset the decrease in pH, which is relating to fatigue. How injury prevention fits within a needs analysis must look at how likely is an injury to occur in that sport. Another is what are the common injury sites and how are these injuries most likely to occur. Is it through contact or is it through non-contact? And which athletes are most prone to these risks for injury? Last, how can an exercise program be developed that will diminish these risks for these athletes? With this, strength and conditioning professionals can work with athletic trainers and team physicians to get a better understanding of each individual athlete's injury and how to design a program for injury prevention. This requires having a team effort and can be vital. So you must keep in mind that each sport has different demands that change the required training stimuli athletes need to encounter during training to decrease the risk of injury, as you can see in the table to the right. A thing to also consider is the athlete's past injuries. Are they more or less prone to injuries? Do they have recurring injuries such as ankle sprains? Knowing this background will further help with designing a program on injury prevention. During this injury prevention portion of a needs analysis, strength and conditioning professionals should consider developing or at least incorporating other testing methods such as examining passive, static, and dynamic ranges of motion that the athlete is able to attain in many positions. Strength and conditioning professionals can have the athlete perform exercise-related movements while they can note a deficit in the athlete's ability to attain the desired range of motion. So, in general, they should also consider gender differences when relating to injury risks. For example, ACL injuries are more likely to occur in female athletes compared to male athletes. Strength and conditioning professionals, along with physical therapists and athletic trainers through the use of needs analysis, can establish an injury prevention program that will improve the athlete's strength and endurance of the musculoskeletal system and the cardiorespiratory system while preventing fatigue and injury. Athletes recovering from an existing injury may require the manipulation of training stimuli within a single program. Athletes may be able to increase their strength in the squat despite the inability to perform full squats due to prior knee or ankle injury. Making the necessary adjustments within the program will allow proper healing. As mentioned before, having a team effort of athletic trainers, team physicians, and physical therapists, this will allow the athlete to recover properly and improve their performance. As mentioned earlier, the training status of an athlete should be considered when developing a program. Another point though to consider is when the athlete begins training during the calendar year. The needs analysis before the actual program will allow the strength and conditioning professional, such as you, develop certain training goals and push them to see adaptations. However, we do not want to push them into a pattern of overloading with the addition of practices that the athlete needs to complete. In some cases, practicing time may interfere with strength and power training. In addition, there may be cases of too much practicing and in combination with training may affect the athlete's ability to repair and recover. Nevertheless, it is important for us to make the necessary adjustments so that the athlete can meet the demands for practice, competition, and have enough time for recovery. There may be some cases to make these adjustments that require no training at all or decreasing the intensity or volume for that day or even week. The body will respond to the demands of training through different variables. Manipulating exercise such as the repetitions, intensity, volume, and the rest periods will help attain particular adaptations for the athlete and their goal, whether that be hypertrophy, power, or strength and endurance. Changing these variables will have adaptations through neurological, structural, and hormonal changes. For this to occur, a high enough stress must be placed on the athlete, which is generally called an overload. This overloading will result in functional overreaching and progress throughout the training program. Initially, when starting to train, athletes will experience acute fatigue and a temporary reduction in performance. However, this is going to quickly return to normal or even higher function after a few days. Long-term overreaching will cause fatigue and performance to be suppressed for several days or possibly maybe weeks, but when they rebound, it results in an increase above pre-training values. You can see the response of the overload versus functional overreaching in the figure on the right side of the text. One thing to note is that with long-term overreaching, the recovery occurs between 3 to 17 days. So, like I just mentioned, it could be weeks for this recovery to shoot back up to above pre-training values. However, this does not mean to completely stop training, as this is part of an adaptation to improve performance. The manipulation of variables can be a delicate balancing act. Therefore, monitoring workout logs and testing athletes should be considered. If done incorrectly, the athlete may experience symptoms of non-functional overreaching. Even though the athlete will have the same neurological, structural, and hormonal changes as seen with functional overreaching, they will be unable to positively adapt without rest. Their performance will decline and some of the training adaptations may be lost. If left unattended, the athlete can enter overtraining syndrome and may need months to recover their performance. We'll discuss more on overreaching and overtraining later on in this semester. The last thing we'll talk about is integrating various training goals and taking into account both resistance training and cardiorespiratory training into the total conditioning program, which must be carefully planned. When resistance training and cardiorespiratory training are performed at a high intensity simultaneously, an increase in adaptations to muscle size and power are compromised. Some individuals who may be doing too much aerobic training, such as long, slow distance running with resistance training, may also compromise adaptations to muscle size and power. Also, some individuals who want to increase aerobic capacity may think that long distance running is the sole option to increase their VO2 max. However, high-intensity interval training has been shown to increase VO2 max, which can be beneficial for soccer players, basketball players, hockey players, and rugby players as well. Moreover, heavy resistance training in aerobic endurance sports such as marathon runners can be beneficial because it strengthens tissues and helps prevent injury. There are other factors to consider as well when designing a program, such as incorporating speed, agility, sport-specific activities, and plyometrics. Nevertheless, analysis of physiological and biomechanical demands of the sport and position of the athlete must be met, followed by testing to monitor progress. Lastly, proper periodization and rest periods are important components for recovery and to help reduce overtraining. Just to recap, the strength and conditioning professionals must carefully evaluate the individual athlete and the sport in order to understand the needs within a resistance training program and the demands of a total conditioning program. Also, the essential aspects of a needs analysis for any athlete include the metabolic demands, the biomechanical demands, and potential injury risks of the sport. Also, integrating the resistance training program with other conditioning activities is an important aspect of total conditioning. Training goals must be prioritized, training must be periodized, and non-functional overreaching and overtraining must be addressed. The professionals must be dedicated to improving the physical development of athletes within the construct of their age, psychological development, physical toleration of the training, and proper progression of the program. As such, a needs analysis is a vital part of the design of any conditioning program, especially the resistance training program.